This is Deepak Kapoor. I'm president of Advanced Urology Centers of New York, as well as associate clinical professor of urology at the Mount Sinai School of Medicine. And we're speaking today about prostate cancer awareness. Mm-hmm. Additional information can be found on our website, which is aucofny.com, or at the Integrated Medical Foundation website, www.imfcares.org.
First of all, this is September, and it's Prostate Cancer Awareness Month. And you have a great idea to put Dad on the back-to-school checklist. What do you mean by that?
Well, Pat, first of all, let me thank you for taking the opportunity to speak to your listeners about this important subject. Despite recent controversies, prostate cancer remains the most commonly diagnosed solid tumor in men. Nearly 250,000 men will get prostate cancer this year, Pat, which means that's 1 out of every 7 men during their lifetime will suffer from this disease. And despite all the advances in diagnosis and treatment, still prostate cancer remains the second leading cause of cancer death. Almost 35,000 men will die this year of prostate cancer. That's 1 man every 30 minutes dying of prostate cancer for this disease. So it's really important for men to understand that the only way for us to combat this disease is to diagnose it early, and we can treat it early. So September is when a lot of families are having their children go back to school, and it happens to be Prostate Cancer Awareness Month. So we thought that it would be great as families create their back-to-school checklist for their kids that they put a prostate checkup for Dad right on that checklist.
Now, PSA tests have become quite controversial, just as mammograms have become controversial for women. But even President Obama has had one, so that tells you a lot.
Well, that's exactly right, and that point regarding President Obama is great. Some of the confusion about PSA testing arose from a recommendation that came from a government task force called the USPSTF, the United States Preventative Services Task Force. And unfortunately, they made their recommendation prematurely. They looked at 2 studies. One of them wasn't completely mature yet, and the other study was a little bit incomplete. Now, interesting, the study that wasn't mature, which is the largest study that's ever been done on prostate cancer screening, it's called the ERSPC, or the European Randomized Screening for Prostate Cancer Trial. Mm-hmm. They just released their more updated results, and the results are definitive. That PSA screening found that even if you started screening after age 60, there was a 20% reduction in cancer death. And even more importantly, if you started screening for prostate cancer before age 60, there was a 50% decrease in deaths from prostate cancer. So that controversy, as far as the urological community is concerned, has really been put to bed. As the studies get farther and farther along, we see that the survival advantage for prostate cancer screening becomes greater and greater. So men need to put aside the debate regarding screening. And we have to remember that testing for prostate cancer doesn't mean that we have to treat prostate cancer. Now, there are some prostate cancers that are slow-growing, mm-hmm. but as we can see from the death rate, there are some prostate cancers that are very aggressive. But, Pat, unfortunately, the most common symptom of prostate cancer is no symptoms whatsoever.
I was going to ask, there aren't any symptoms for prostate cancer usually, right?
Yeah, that's exactly the point. So if you don't look proactively for the disease, you won't find it. So for men, they have to be aware by the time they become symptomatic from the disease, the opportunity for cure is lost. And that's the real tragedy. With the advances in treatment modalities that we have, whether they be surgical therapy or radiation, or even in some cases, we can watch the disease very closely and defer immediate therapy. The cure rate is astronomical. Pat, when I started in urology, which was in the early 1980s, the 10-year survival for prostate cancer was 50%. The 10-year survival for prostate cancer now is 99%.
Wow. Big difference.
Huge. And it has to do with getting to the disease early. So, So the most important thing for men to understand is that a PSA is a simple blood test, and we've taken a much more nuanced approach to PSA testing. We now recognize that it isn't necessary to screen the entire population all the time, but it's important for men to have a conversation with their doctors. Now, there are certain men, Pat, that are at very high risk for prostate cancer, like African Americans or people with a family history of disease. Mm-hmm. Those men probably should start screening at an earlier age and have it a little bit more often.
Yeah. Now, most men, except for African Americans, and if there is a history in your family, most men should start at what age? 50, I've heard.
Well, that was our historical recommendation, and but that's been modified recently, and I'm glad you asked. That's a great point, Pat. Right now, the most current recommendations from an international symposium that convened last year in Australia was that every man should get a baseline PSA sometime in their 40s. So, and that's just a baseline, so we know where to work off of. And from that baseline, the urologist or other doctor will be able to determine what is the appropriate interval. So if you have a very low baseline PSA, you may not need another test for 5 years or whatever. But depending on that baseline and depending on your risk factors, like being African American or having a family history, that will determine the interval in which you have your follow-up PSAs, because more recent data has shown that if your baseline PSA is very, very low, that your lifetime risk of developing prostate cancer is much lower than if your baseline PSA, even if it's in a normal range, is more in a high normal range. So we've developed PSA testing. It's really not a blunt instrument. It's a very nuanced test that has a lot of subtlety to its interpretation. So that's why it's so important for men to talk to their doctors about this test and see whether or not it's right for them.
Dr. Kapoor, there have been articles saying that most men will get prostate cancer in their lifetimes, but that it won't kill them. What do you say about that?
Well, again, it is true that 1 out of 7 men will get prostate cancer in their lifetime. But remember, of the 200 and some odd thousand men that get prostate cancer, 33,000 are going to die this year. So the idea that prostate cancer is not a killer is completely false.
Yeah.
Remember, prostate cancer is the second leading cause of cancer death in men. The second leading cause of cancer death. Wow. So it's a very significant disease. Now, that said, there's no question that there are some men for whom immediate treatment can be delayed. But the point is that fears about treatment should not prevent you from having the diagnosis. You should at least know what's going on in your own body so you can make the best informed decision for yourself. And that's the whole point about PSA testing. A PSA test is not a commitment to have a biopsy. And if the biopsy is positive, it's not a commitment to undergo aggressive therapy. It's simply a piece of information that you can use to talk to your doctor and your family about what is the healthcare decision that's right for you.
I like your passion. It really translates very well. Tell me about, I may mess up the pronunciation, Prostate?
Yeah, Prostate is you can almost consider it like an immunization against recurrent disease for men with prostate cancer. And it's one of the things that Advanced Urology Centers of New York, we're happy to partner with our partner organization, Advanced Radiation Centers of New York, to be the first in the New York area to offer this novel therapy. And that's administered by a radiation oncologist, and the preliminary results are very exciting that we're able to actually almost immunize the prostate against recurrent disease after therapy. So it's one of the exciting new modalities of therapy, like many other new modalities of therapy that we're coming out with. So another one, for example, is that there are drug therapies that we have for patients who have advanced prostate cancer. Only 10 years ago, we didn't have anything for advanced prostate cancer. And now we have a number of new therapies that are giving hope even to those men that we don't catch early enough so that we can extend their lives as well. So, as far as the diagnosis and treatment of prostate cancer, this is a very exciting time for those of us that are involved in this disease, because we're getting more and more arrows in our armamentarium to fight this.
Thank goodness. Yeah.
Yeah, for a long time, we just didn't. Our options were limited, and now for the patient that has prostate cancer, in terms of so let me give you another, for example. One of the things that we always struggled with is, as you alluded to earlier, some men with prostate cancer don't die from the disease, they die with the disease. It can be slow growing. But our challenge has been to differentiate those men from the disease that's more aggressive. What we used to call the hares versus the turtles. The hares being the fast runners and the turtles being the slow growing ones. Well, we now have a whole battery of molecular tests that enable us to identify those patients with high-risk disease in a much more sophisticated fashion. So whether it be Prostate or the molecular diagnostics or the advances in surgery and radiation or the advanced therapies for people with more progressive disease, this is a truly exciting time to be involved in cancer therapy, because we have so much more to offer for patients. But the first step has to be for the patient to proactively go to the doctor and get checked.
Can I ask you another question about Prostate?
Sure.
Is it a vaccine, as we understand vaccines? Is that what? And is it given to somebody who has already been diagnosed with prostate cancer?
Yes, that's precisely right. It is for somebody that's already been diagnosed with prostate cancer, and it's we term it a vaccine, but it's similar to a vaccine in that you're having the body create its own immunological response against the disease. So, it's not the same thing as being vaccinated, for diphtheria or measles or something like that.
Yes.
But as far as the layperson is concerned, that's the closest analogy that we have. So what it is, we use something that's called gene-mediated cytotoxic immunotherapy, which is a lot of letters, but basically it unleashes the body's own disease-fighting cells against the patient's cancer cells. So we use that in conjunction with radiation therapy to jumpstart the body's immune system so it can detect and destroy cancer cells to reduce the risk of a cancer returning.
That's fascinating. Is this pretty new?
Yes, it's very novel. As I said, we're excited to partner with Advanced Radiation Centers of New York to be the first in the New York area to offer this therapy.
Well, Dr. Kapoor, you were fascinating and very, very good, and we've talked for almost 15 minutes.
The time
it does.
It always seems to get away from me when I tend to get excited. I'm sorry about that.
Well, are you kidding? This is fantastic. I'm so glad I talked to you today. I learned so much. Anything you would like to leave us as we conclude the interview?
Absolutely. The most important thing for patients to remember is that early detection saves lives.